Sounds True presents Self-Healing with Energy Medicine with the founder and director of the program in integrative medicine at the University of Arizona, Dr. Andrew Weil, and medical doctor and energy medicine healer, Dr. Anne-Marie Chiasson. And now Session 1, Energy Medicine, an ancient alternative for self-healing, with Dr. Andrew Weil and Dr. Anne-Marie Chiasson.
Hello, this is Dr. Andrew Weil, Director of the Arizona Center for Integrative Medicine. I'd like to welcome you to this audio program on self-healing with energy medicine. Energy medicine is a broad concept. I think it includes, on the one hand, the use of forms of energy for the diagnosis and treatment of illness that conventional doctors are familiar with. Everything from taking x-rays and electrocardiograms, electroencephalograms, or using laser treatments, diathermy treatments, nuclear radiation. This is all energy medicine. That's the conventional end of the spectrum. At the other end of the spectrum is the use of subtle energies, that is, energies which can't yet be measured by the techniques of conventional science, by practitioners who diagnose problems in patients' energy fields or energy flows and then transmit energy to them. And this is systems like Jinshin Jitsu and Reiki, therapeutic touch, and so forth. And then, in between all this is a whole range of phenomena, everything from how crystals might affect people to how different wavelengths of light may affect people's health, color therapy, light therapy, sound therapy, which includes everything from toning to singing to chanting and how this affects the physical body, as well as investigating and being aware how the energy of particular places might have an effect on health. So I think energy medicine encompasses all of this. In this program, we're particularly going to be talking about the more formal kind of energy medicine, that is sensing energy fields, energy blockages, and then transmitting energy to yourself or receiving it from another person in order to harmonize energy flows in the body. And in addition, becoming aware of and working with the natural energies that surround you every day, that come from your physical environment, from the natural world, from other people that you encounter, and so forth, and using those in ways that promote and maintain your health. Now, I first encountered energy medicine many years ago in the form of a system called therapeutic touch, which was mostly being practiced by nurses, and generally physicians were unfamiliar with it. And therapeutic touch is a method of both sensing a patient's energy field and determining whether there are any imbalances in it, and also treating people by transmitting energy through the hands, which can either be placed on the body or actually not in contact with the body. And in the early 1980s, I was teaching medical students at the University of Arizona, where I was on the faculty, and a PhD nursing student contacted me. She was doing a thesis on therapeutic touch, trying to demonstrate in a controlled experiment compared to a placebo, which was sham therapeutic touch, where the practitioners weren't actually transmitting energy, but were just holding their hands out, and I think they were told to count backwards in sevens in their head rather than thinking about transmitting any kind of energy. She tested this for relief of chronic pain in a very carefully designed experiment and was getting very good results. While the experiment was in progress, she got hold of me and said she'd love to come in and talk about her work with my medical student discussion group. So this was a group of about 40 students, and we met in a student's home. And she had us do some very simple experiments. The first was having each person rub their hands together vigorously and then separate them by an inch or two and move them slowly in and out and see if they could get a sense of the energy field between them. And when I did this, my sense was a feeling of heat and something that sort of had substance that I could slightly compress, and it was very interesting to get a sense of that, and I think almost everybody in the room had that same feeling. But then she asked us to do an experiment, which I thought was very dramatic. She had us pair off, and one person sat in front of the other person, and one person who was the receiver held their hands out with the palms up, and the other person who was the sender put their hands over the receiver's hands but not in contact with them. And then we were asked to close our eyes, and the transmitter was asked to try to send energy through one hand only. And the receiver, when he or she felt that energy, was to tap the hand that they felt the energy coming from. And I would say that within about 10 minutes, the success rate was somewhere between 90 and 100%. And then we would reverse roles and the person who was sending became the receiver. But this was a very remarkable demonstration that in a group of 40 medical students, many of whom had no experience of this and many of whom were skeptical of the whole thing, that this simple experience convinced us that it was very possible to sense energy and to get a sense of sending it as well. So that's the kind of energy we're talking about in this program. And if we want to call it subtle energy, you can do that. My sense since that time, I've done a lot of experimenting and I've received energy treatments. And my own sense of this kind of energy, I feel it often as a vibrational energy. That is a kind of buzzing. It can be of low volume, high volume. And I feel this from a lot of things. I can feel it in my own body. I can feel it in other people's bodies. And then I became very interested in systems of using this energy for diagnosis and treatment. And I learned that many of these formal systems of energy healing really can be traced to Japan, to China, and ultimately to ancient India. But the concept of energy and the transmission of energy through the hands from one person to another, I think you see this in all cultures through all ages of history. So you are just as likely to find forms of energy medicine appearing in indigenous cultures in the Americas that are probably quite independent of these formal developments from Asia. In these various systems, practitioners are trained. My sense is that all people have an ability to detect energy and probably to send it, but I think there are some extraordinary people who have this as a real talent and can develop it through training. One of the systems that I first got some acquaintance with was Jinshin Jitsu because the teacher of it lived in Phoenix, Arizona, and many of her students were here. And one of my first experiences with this was, again, quite a while ago. I was lecturing at a conference in California, and I was very tired. I had, for one reason or another, not gotten enough sleep, and I had to give this lecture. And a woman who was a Jinshin practitioner said she would give me a treatment. And she asked me to lie on my back, and I was talking with several people, and she said it was okay to go on carrying on the conversation. So I really wasn't paying much attention to what she was doing. She put 2 fingers of each hand on my body, and she would hold 2 points for a period of time and then move and hold 2 other points. And I was hardly aware of what she was doing. It was very light touch. And after about 20 minutes, she said she was done. And I suddenly noticed that my fatigue was completely dissipated, and I felt full of energy, and my mind was clear, and I gave a wonderful talk. And when it was done, I crashed. I really felt tired and had to sleep. But that was quite remarkable because I wasn't expecting anything, and it was a very dramatic experience. Because I had experimented with Jinshin and with Reiki and began to recommend certain patients go to energy practitioners, when I started the integrative medicine program at the University of Arizona, I wanted to include energy medicine as one of the subject areas that we would train physicians and other health professionals in. And we brought in as a guest faculty member a very accomplished energy practitioner named Rosalind Briere. Some of you may know her name. She still is very active in teaching, and she's worked with a lot of medical researchers to document the phenomenon. She was a wonderful teacher, and she would come in periodically to work with our resident physician fellows. And one time when she was visiting, I also had a cold, but this had left me with a lingering sore throat that had gone on for weeks. And I tried all my remedies, all the herbal things I could take, everything, and it would not go away. So I mentioned to Rosalind that I had this. I asked her if she could do anything for me, and she said to lie down, and she put her 2 hands on my neck instantly, I felt, and this was not subtle, I felt a very strong vibratory energy coming from her hands. It was a coarse, loud vibration. And again, I can only say this was not subtle. This was a very dramatic sensory experience. After a few minutes, I could feel this vibration going through my whole body, down to my feet. And she did this for about 10 minutes. And when she stopped and I got up, I could still feel this vibration running through my body. And I mentioned that to her. And she said that some very sensitive people might feel this for a few days afterwards. I didn't feel it for a few days, but I did feel it for a few hours. And when I woke up the next morning, the sore throat was gone. Now, that could have been a coincidence. I can't say definitely that was a cause and effect thing, but all I can say is if she were around again and I had something like that, I would certainly go to her, and I would certainly use energy medicine for common ailments, and do. Sometimes people ask me, what is the difference between energy medicine and mind-body medicine? And I guess there's an overlap here because really the mind is also an energetic phenomenon, and I think different emotional states correlate with different kinds of energies. So I would say that the mind-body connection, there's some overlap there with what we talk about energy, but that energy medicine is a much broader field and often does not have to do with the mental, emotional states of either the giver or the receiver. I think it's possible to use energy medicine on yourself, and I have done this. You can sense areas of your body that are deficient in energy. For example, I think a lot of musculoskeletal ailments actually represent blocked energy, and you can feel this in yourself. Something's just different there. The tissue feels different. And I think it's possible to put your own hand on that area and to practice sending energy, either however you experience it, as heat or as vibration, into that to see what you can do. So I think it's perfectly possible to sense energy in your own body, to sense areas that either have deficiencies or excesses of energy, and to try to work on them. But I think it can also be very useful to receive treatment from a skilled energy practitioner. And there are lots of ways of doing that. It can be from a friend. I think we all know that just having anyone put their hands on you with the intention of making you feel better often makes you feel better. But I think if you go to somebody who's trained, this can be extremely effective. And really, I don't know that there's any contraindications for energy medicine. I've never seen it do harm. I certainly would not use it as the exclusive treatment for an acute or severe medical problem. But even with an acute or severe medical problem, I think it can be a very useful adjunctive therapy. Even somebody who's a victim of severe trauma, receiving energy treatment can help them attain a mental space of calmness and relaxation that can change their physiology in a way that make them much less likely to have the worst kinds of consequences of the trauma and respond much better to the treatments that are given to them. So I frequently recommend energy work to all sorts of patients, to people who are well, to people who are fatigued, to people with chronic medical conditions. I think it can be extremely useful. When I think about my own experiences of subtle energies, I guess I have a lot of them. Some I've experienced in altered states of consciousness, attained in various ways. And in some of these, I've been able to sense energy really in everything, and both something that I perceive as this vibratory feeling that I described earlier, but also sometimes that is visual, a kind of luminosity or luminous corpuscles that flow through everything. And I remember one experience. I was in a canyon in Arizona and was lying on some beautiful water-polished rocks along the bottom of this canyon. And I began to feel energy coming from these rocks and flowing through my body, and also to have this sense of this self-luminous flow of corpuscles of light energy that were continuous with me and the rock, that there was no difference between whatever this fundamental substance or fundamental stuff that was flowing through me in the universe. And it felt very good to be able to sense that. And it seemed to me that everything was made up of this, or that it flowed through everything, but was limited or shaped by form, so that the form of the rock imposed a certain pattern on the flow of energy, or the form of a cactus did, or the form of my body. But the feeling that was most powerful was that on a fundamental level, there was nothing different between me and plants and animals. We were all united by this kind of energy. And the sense was that whatever this stuff is, that's the most essential stuff out there, that it was self-luminous and probably self-aware. Now, physicists talk a lot about energetic fields, electromagnetic fields, for example, and the concept of a field is rather difficult to get because it's something we can't perceive. If you can remember experiments in which you put a magnet under a piece of paper and pour iron filings on it, and the iron filings assume the pattern of the lines of energy, of the lines of force, and that kind of makes a field visible. Probably our bodies have energetic fields, and I suspect all objects have energetic fields, and this universal energy that flows through us and through everything follows lines and has patterns that are defined by that kind of field. So that, for example, a dog is a dog because that's the defined field through which this universal energy flows, whereas a human is different because we have a different pattern that the energy is flowing through. So when I describe seeing and feeling this universal energy flowing through these big rocks in a canyon and me and cactuses, my sense was that the content was all the same, but that the field or pattern through which it flowed and which it assumed was defined and imposed on it. Some of you may have seen photographs of a labyrinth that I constructed at my residence outside of Tucson. I became very interested in labyrinths as meditation devices and built a large one out of rocks. This uses the pattern of the famous labyrinth on the floor of Chartres Cathedral in France, which is the one that's most frequently copied. And I did this with a few friends. It took us 3 months to construct this. It's a big construction, and it takes about 20 minutes to walk into the center and out. And we decided to erect a center stone in the labyrinth. That's not commonly done, but it just seemed to be a good idea. So I got a large rock. It's just an ordinary huge rock from a landscape place. It stands about 3 feet high, and we set this up in the center of the labyrinth. There's a very interesting acoustic effect in the labyrinth, and this is reported in books on labyrinths and is said to be a function of sacred geometry, that when you're in the center, there's a kind of echo or resonance, and this is something everybody perceives. It's not subtle at all. About 6 months after the labyrinth was built, there was a devastating flood that came through my property, and the stones were scattered, the center stone was knocked over, and we got a big party of volunteers and reconstructed it in fairly short order and put the rock back upright. And the acoustic effect was now much stronger. I don't know why, but also there was another interesting effect, that when I put my hands on this rock, I felt energy coming from it, and it was a really intense, warm, buzzing energy. Now, it's also gotten stronger since then, and as more people have used the labyrinth and been in it, I would say about 60% of people who come feel this, and the other 40% don't, and they're quite mystified at what we're talking about. So this is interesting that not everybody feels this, but those who do all report it in the same way, as a kind of buzzing electric energy. Now, my other sense with this is that if I keep my hands on the rock for more than a few minutes, when I take my hands away, the buzzing continues. And I like this, and my sense is that I can charge myself up on this rock. By the way, where I live is in an interesting formation of mountains bordering on a national park, and it seems to me that the labyrinth is set up in a way that focuses the earth energy of that region in some way and concentrates it. So what I've been practicing at the moment, and maybe in the future I'll be able to come back and report on this, is to charge up my hands in this way and then see if I can then transmit that to other things. So if I have a dog that's hurt in some way, I can go and give an energy treatment, or I can do it to myself. You know, maybe any rock that you put your hands on, you can feel something from. I don't know. I don't know what this is, but I would say that since I've been interested in these things and since I've been practicing them, I've become more and more sensitive. I also find that some people seem to be very sensitive to energy, and that may have medical implications as well, because we see a lot of people these days who have mysterious ailments. They're fatigued, they're depressed, they have various physiological imbalances. We have no way to account for them. And it's not impossible that this represents an energetic phenomenon, that there are people who are very sensitive to energy say that some buildings, some locations have sick energy in them or unhealthy energy. And maybe what needs to be done, if we've ruled out all other medical causes, is to suggest that people get out of those environments or expose themselves to healthier forms of energy, such as around running natural water, for example. So these are all things to consider. I would predict to you that the field of energy medicine is going to become a large part of medicine in the future. At the moment, conventional medicine is very much matter medicine. And although we use some forms of energy to diagnose and treat disease, we are so focused on the physical, material body, and almost all of our treatments involve giving people material substances in the form of pharmaceutical drugs. So, we hit people very hard on the material level, and we really don't think about how much more we could be doing on the subtle or energetic level. Homeopathy, a very strange historical system of medicine that uses extremely dilute remedies, so dilute that sometimes there are almost no molecules of the original substances left, I think really falls under the heading of energy medicine. And in some ways, if homeopathy works, it works by delivering some sort of informational or energetic signal to a person. That is, the power of the remedy is not dependent on the matter that's present in it, but on something else. I think that there's a great deal of research going on now on sound healing, and I have done some audio programs on that subject as well that you can look up. This is a very developing field, everything from using music therapy for patients to using chanting, drumming to affect physiology. But I would predict that we're going to see a greater and greater role for energy medicine, and this is one reason I'm very glad that I brought it into integrative medicine. I think energy medicine has the potential to develop effective treatments for many ailments that are much less causative of harm than many conventional treatments, and maybe much more cost-effective as well, not to mention that they may be enjoyable both for practitioners and patients. It's no secret that our healthcare system and healthcare systems around the world are collapsing for several reasons, but principally because we are not trying to promote health and prevent illness, but intervening in established illness. And the kinds of interventions that conventional medicine depends on are expensive because they depend on costly technology. One of the main goals of integrative medicine is to develop cost-effective methods of treatment, as well as to emphasize disease prevention and health promotion. And I feel that energy medicine has great potential in these areas. First of all, I think that energy medicine can help us maintain and direct our energy properly as we age. It's generally accepted and experienced that as we grow older, our energy decreases. I mean, one way you can see this is that the healing ability of young people is extremely high, whether you look at wound healing, the ability to heal a broken bone. And in old people, this is much less. It takes longer for healing to occur. And ultimately, this has to do with the second law of thermodynamics, that things run down, that things become more disordered, and time's arrow flows in one direction. So I personally think that it's a waste of time to try to reverse the aging process or stop the aging process. I think what we should be doing is accept aging and then learn how we maintain health as we grow older. So that means conserving energy as much as possible, not wasting it, looking at ways that it might be leaking and blocking those leaks, and then also adjusting our activities and way of living to lowered levels of energy. So that things that might have been appropriate to do when you're in your 20s and 30s are not appropriate when you're in your 50s, 60s, or 70s. I think that's all part of the wisdom of aging. When I was first studying traditional Chinese medicine, one of the concepts underlying it that made most sense to me was the distinction in that system between what It's called invisible illness and visible illness. The Chinese medical philosophers say that all visible illness is preceded by invisible illness. And what they mean by that is a disturbance in energy flow through the body, the flow of qi. So there's either too much or too little energy in particular organs. And their concept is that if this is not corrected, eventually that energy illness will crystallize into a disturbance in the matter or form of the body. So from the Chinese point of view, what we in the West diagnose as early symptoms of illness may in fact be middle or late symptoms of illness, because we don't recognize the invisible part, since all our focus is on the physical body and not on the energetic body. So if in fact all illness, and especially chronic illness, begins as an energy disturbance in the body, being able to recognize that, to diagnose it, and do something about it would be a very powerful method of disease prevention, and one that would be extremely cost-effective. So one thing that you might do is to try to pay attention when you get sick to see if you can sense or remember a period right before you got the first physical symptoms in which you felt something off in your body. That would be a good step toward increasing self-awareness of energy flows through the body and knowing what you can do with them. Now, I don't think energy medicine can fix everything, and probably the more advanced a visible illness is, that is, the more a disease has crystallized into the form of the body, the less the chance of affecting it purely by an energy treatment alone. So energy medicine might be most powerful as a preventive technique, as a restorative technique. But as I said, there's no reason not to use it for anything because it can't do harm. And even when there is severe physical illness, I think it can relieve symptoms, it can relieve discomfort, it can increase vitality. Sometimes people can't get better, or they can't heal just because there's insufficient vital energy in a person. And an energy healer might be able to supply that. One recommendation I would give you is to try to become aware of ways in which your life energy may be wasted or drained, and to try to deal with those problems. I think some people dissipate life energy in various ways. This can be as a result of certain mental and emotional states, physical activities, or even the kinds of people that you choose to be around. And this is an interesting exercise I would recommend to you. Pay attention to how you feel in the company of different people. With some people, do you feel more alert, awake, clear-headed, energetic, while with others, a kind of cloud comes over your mind and you feel drained after you've been with them? I think that we affect each other on an energetic level all the time. And in a way, this is kind of like the resonance phenomenon that you see with tuning forks when one is brought into the presence of another. Your energy is affected by the energy of other people. So pay attention to this, and it may be a good idea to spend more time in the company of people who increase your energy and to spend less time in the company of people who seem to drain it. That may also apply to situations that you're in, to places that you're in. Pay attention to all this. It can be a valuable technique to help you conserve your vital energy, especially as you grow older. I, as you know, often recommend that people work with breath as a basic healing technique and preventive technique. So here's a very simple exercise that can give you a sense of the connection between breath and energy. This is a yogic breathing technique, sometimes called the bellows breath, well known, and it has a very fast, dramatic effect on your energy that I think you'll be able to feel. So the way to do this, if you're seated, keep your back straight and your feet on the floor, close your eyes, and then you're going to breathe in and out through your nose very rapidly, imitating the action of a bellows. And you will feel the effort in your diaphragm and also in the muscles just above your collarbones. So try this now, trying to keep inhalation and exhalation equal, but very rapid in and out breathing. Okay, and I want you to do this let's do it for 15 seconds. start. Okay, stop. Now just breathe normally. Don't try to influence your breath and sense what's different about your body. I think most people who do this will say they feel warmer. It is real muscular effort. It's an exercise. You can train yourself to do this up for a minute at a time, and it's a very good way if you're feeling cold to warm yourself up. But more than that, besides feeling warmer, see what you can feel throughout your body. When I do this, I feel that vibratory energy that I talked to you about, especially in my arms. I feel it in my arms and hands. So this is a good practice that you might want to try if you really want to get into your body and become aware of the subtle energies that flow through it. Good thing to do. And then I also think, consistent with what I've talked about earlier in this program, that trying to sense energy in yourself is a very useful thing to do. And you may sense that different from the way that I do. You may sense it as heat, warmth. I said I tend to feel it as kind of vibration, subtle buzzing. Some people may see this. You may feel it as something that has almost a kind of substance to it. I think everyone has the ability to sense this, to influence it. I think if you have companion animals, it's very easy to notice how animals respond to different energy. And this is not just emotional states, but I have often seen dogs and cats just gravitate to and soak up the energy that a good energy transmitter can send. So, these are all interesting experiments to try. So I think there are many implications and possibilities for bringing energy medicine into everyday life. So this doesn't just mean trying to find some hand healer out there, but I think it's attending to the health and quality of the energy in your living space. I think it's paying attention to how your energy varies from day to day, how it correlates with your intuition, with your creativity. I think all of these are good things to become aware of. I also recommend that you pay attention to how energy of places affect you and try to find places that you can go to that amp up your energy. That can be a park if you live in a city. I often find that old trees do this for me. And if I can seek out an old wonderful tree and just sit under it or touch it, I often can tap into the energy of that and draw on it. I think there are, many possibilities in nature, easy to find places that seem very energetic and wonderful. There may be some places that work for everyone, and there may be some that work for you and not for others. So this is something you'll have to do to experiment for yourself. One of the recommendations that I've made in my 8-week program for Optimum Health is to listen often to music that makes you feel more energized, more optimistic. This is an energetic phenomenon. It's a method of using sound to affect your nervous system and mental emotional states. I recommended that people bring flowers into their home for the same reason. I find that when I look at fresh flowers, I just feel good, and it affects me. So there are lots of things you can do like this. Another recommendation that I've often made is to try to create a little area in your home that's a special place for you, where you can put objects that you get good energy from. You can make the aesthetics of this a place that appeal to you, and then use this. Create a little special area. It can be a nook, a corner, maybe a whole room if you can, but a place that you can go to. So you're out on a busy day, you come home, just go to your place, sit there, and just absorb the energy from that which you have helped create by arranging the space to affect you in a good way. I think that life today is often so complicated, and there's so many ways that we can be drained of energy. It's important to take these steps for your own self-healing. And you'll find as you go through life that you'll see many people around you who are your contemporaries who look tired and have no energy, look old beyond their time, and you'll see other people who seem to have terrific vitality. Even though their faces are wrinkled and their hair is gray, they have great vitality. And basic energy. And I think these are people who have learned, some consciously, some unconsciously, to conserve their energy, to protect it, to draw on nourishing, healing energy from other people, from places. And you can do this too. So my wish for you is that you learn to become more aware of energy in yourself and in everything around you, that you develop the ability to sense energy, to become aware of energy blockages in yourself, to learn ways of harmonizing the energy flow through your body, and to be able to find, when necessary, good practitioners of energy medicine who can help you if you need. And I think we can all help bring about the paradigm shift that we'd like to see, in which the dominance of materialism on our science and medicine diminishes, and we become more interested in, more aware, and more able to use these more subtle phenomena that have to do with basic energy. So in this audio program, we're going to give you some very practical instruction about using subtle energies for self-healing. And the practitioner who is going to work with you on this is a friend and colleague of mine, Dr. Anne-Marie Chiasson. She's a Canadian-trained family practitioner and also a practitioner of integrative medicine who lives in Tucson, Arizona, where she's clinical assistant professor of medicine at our Arizona Center for Integrative Medicine and also the medical director for Valor Hospice. Her real passion is energy medicine, and so that makes her very unusual as a medical doctor and somebody who is really trained and interested in this field. She's also very interested in indigenous healing practices and ceremony in both North and South America, and uses these in her healing work as well. She's going to give you some very practical instruction in using subtle energies for your own well-being.
Hi, I'm Dr. Anne-Marie Chiasson. Today I'll be talking to you about energy medicine. I'm an integrative medicine practitioner, which means that I am trained in conventional medicine, which I love, as well as botanical medicine. I know some about traditional Chinese medicine, homeopathy, mind-body medicine, spirituality, and energy medicine. I began studying energy medicine and energy medicine techniques over 19 years ago, and I have studied healing touch and therapeutic touch and Reiki in our culture, as well as seeing indigenous healers and shamans in Asia and Africa and Mexico and South America. What I find fascinating is the similarities with these different practices, even though they're vastly different cultures. And that's the thread that I've been following when I've been studying energy medicine is how did the different cultures do the same thing and how are they different in what they're doing? When I practice, I don't just practice energy medicine. I usually practice a mix of all these different modalities, including conventional medicine. I have a great love for conventional medicine, and I like where they interact, and I find the interface between conventional medicine and energy medicine particularly exciting. I studied energy medicine before I went to medical school. So when I went to medical school, there was no split for me between energy medicine and conventional medicine. I spent the whole time trying to figure out how they work together. And in fact, I would scan my patients with my hands while I was doing my conventional diagnosis to see how does the energy field work with a gallstone attack? How does the energy field work with a renal tumor? How do these two work together? So from my perspective, how conventional medicine and energy medicine work together is exciting. So it was only in the late 1700s and early 1800s that physicians began to look at the body based on organ system, the heart being one system, the kidneys being another system, the liver being another system. And we've made great leaps in the field of medicine from that change in perspective. So my sense of what's happening now is that we've gone from this organ system view of the body, and now we're reincorporating or reintegrating the other viewpoint of a vital force or energy field that is also affecting the body. Now, what is this underlying energy field, and how do you map it out? Is there an anatomy? Well, it turns out that the anatomy depends on the culture you're in.
that each culture has the concept of an underlying energy field or subtle body, and each culture maps it out differently. For example, in the Taoist viewpoint from Asia, they talk about 3 energy centers, one in the lower portion of the body, one in the mid-body, and one in the head center. They're called danjans or dantians. And those are the major energy centers that the body relies upon for health and vitality. If you look at the chakra system from India, there are 7 centers. And this is the system that most of us go by now in the Western world. There are 7 centers. They start at the root chakra and they go all the way up to the top of the head. These are described as wheels of energy that are spinning. And according to how well they're spinning and how they're functioning, that determines the health of the body. If you look at the traditional Chinese medical system, they talk about a qi ball that's in the body and then meridian systems or energy flows that flow up and down throughout the body that affect the health of the body. If you move into some of the Aboriginal and also Mexican views of the body, they describe the energy field as being a grid or a matrix of energy, and that when there's an illness there, there's a tangle in the energy field. The thing I find most interesting is that healers perceive different energy fields according to the system they were trained in. So if I have a traditional Chinese medical doctor in to scan a patient, and I had a Taoist in to scan a patient, and I had someone trained in the chakra system to scan the patient, they would all come up with a different way of describing what they saw. I think these systems or different interpretations are actually different layers of the energy body. Same way that we have organs and bones and muscles. So, for example, I think the deepest layer is the qi ball or the hara line in traditional Chinese medicine. And that would be a layer like bone, as deep as you can get, or marrow. Then the next layer, I think, is the Taoist layer, where they have 3 energy centers. The next layer that comes farther to the surface would be the chakra system with the 7 energy balls. And then the most superficial layer to me is the traditional Chinese medicine meridian layer. So what I think different healers are doing is that they're pitching their awareness into different layers of the energy field, the same way an orthopedic surgeon would look at bone, and a gastroenterologist would look at the gut, and a cardiologist would look at the heart. And for me, when I pitch my awareness into different layers, I can pick up these different systems all in the same body. I don't think it actually matters which system that you go into for your healing or how you start to approach this. If you've been healing for 15 or 20 years, then the subtle differences between these different layers make a big difference. But as a beginner moving into energy medicine, you just pick one and learn it. In session 2, I'm going to start teaching you self-healing, both using the Taoist centers, called dantians, and the 7 centers in the chakra system. Before illness manifests on a physical level, or before the body starts to work or malfunction, usually there's a problem in the subtle body or the energy body. For major illnesses like cancer, usually the problem's been there for a few years. Of course, there are exceptions to this rule, like an accident that causes a broken arm will cause a problem immediately in the energy body. Pain is blocked energy. Whether or not it's been blocked over time or whether or not it's been blocked immediately by, let's say, a fracture. And it's usually blocked energy at the site or closer into the body than the site. So, for example, if somebody has a problem in their elbow, they likely have the block in the elbow, but they might have a block in their shoulder that's causing pain in the elbow. I see this all the time in foot pain. Often the block will be in the hip, and then the pain will be in the foot. It's almost as if there's a buildup. So the way I see it is, if you think about a plumbing system, there's a flow of water that goes through, but if the pipe gets too small or there's a block in the pipe, then there's a buildup. That's what pain is. So my idea of healing and a healthy body from an energy medicine perspective is a body that's balanced between the head, the heart, and the body. That the energy is flowing and the body both can receive and react to whatever is coming toward it. Our culture is focused primarily in the mind, and so in our culture what I notice is that the energy body is actually shifted up and higher than what I would see in an indigenous culture, for example. In the Taoist concept, they talk about a balanced body as a cool head, a neutral heart, and a warm pelvis. And when I work on people here, what I find mostly is that there's a hot head, a neutral heart, and usually their feet are actually quite cold. So when I start working on people energetically, the first thing I do is try to start to help them pull their energy body down lower into their physical body. We usually call that being grounded. And that's usually the first thing that I do when I'm working with a client. In session 2, our first exercise will help with this quite a bit. And I find that this really helps with anxiety and depression. And even things like restless leg syndrome respond really well to grounding exercises. Sometimes that's all people need for their healing to start, is to finally get their energy body into their physical body. There was a point in time after I had my third child where I had gone through a traumatic experience and my energy body had pulled up and out, which is usually what happens. It's almost like people get scared and they go, and the energy body pulls up and out, and so it's no longer rooted in the lower portion of the body. This happened to me, and I went through a depression. It was a postpartum depression, and I had difficulty making decisions and functioning in the world. And I went and saw a healer who was quite skilled at getting me back in alignment. And after she worked on me, I literally felt my energy body clunk back into my physical body, and I actually heard the noise clunk. Since then, I've noticed that some of the clients that come in and see me have the same experience. They'll feel and hear a noise clunk, like it's back into place. The other thing I've noticed when I've been working in energy medicine is that I think we've appropriated the idea that the energy that we're feeling in our body is ours. I find this kind of interesting. The more I move into this concept, people say, well, my energy. I actually don't think it's our energy. And certain indigenous cultures know this for a fact. They know that we're born with a yolk sac of energy, sort of like the Hara line that I discussed in traditional Chinese medicine, and that we use that yolk sac of energy by the time we're about 40. And I certainly see this with my kids. I mean, my kids wake up in the morning, ching, their eyes are open and they're off running. So what I see in most people is that their energy starts decreasing around 40, and around 50 it really starts decreasing, and around 60 they've either figured out they need to do something to gather energy or they're very tired. So once I started understanding that the energy might not actually be mine, that it might be coming from another place, I started to move through the world and do exercises that enlivened my body. So if there's only one idea I want to get across to you in this program, it is follow what enlivens your body instead of what enlivens your mind. Just try that for a little while, and you may start to have a radically different experience of your world, and you may start to dive into self-healing in a different way. One of the reasons I think energy medicine is so important is that I think quite a bit of conflict and harmony is not housed in the mind, but in fact housed in the body. And we don't have a lot of tools in our culture to get to what's going on with the body besides illness. So when we have an illness going on, we know there's something wrong in the body. But how else do we get to the body without it? I want to share a story about conflict that's housed in the body and the mind. About 5 years ago, we were living in a house in Tucson, and we had just renovated it when my husband stumbled upon a new house that he wanted to buy. We went over and looked at the house, and I felt quite a bit of conflict about moving. We had just renovated the old house. This house had some complications, and I was also 7.5 months pregnant, which means that I would be moving probably on my due date. You can see I felt quite a bit of anxiety and conflict about moving. I also knew that if I moved without being comfortable with it, it would be a really difficult experience. Or if we didn't move and I wasn't comfortable with that, then I would be second-guessing myself for a long time. So I sat down and I did an exercise I called the chakra meditation, where I placed my hands on each chakra and asked each chakra and each part of my body how it felt about moving instead of my head, which clearly did not want to move. And what I found was remarkable. I found that in my lower portion of the body, in my root chakra and my second chakra, they really wanted to move. They were so enlivened by the new place, it was amazing to me. And that makes sense because the new house was on a large piece of land. When I got to the third chakra, absolutely not. There was no way I was moving. I found the conflict. The conflict was in the third chakra. It was in my solar plexus area. So when I moved to the fourth chakra, the heart chakra, it was fine either way. And when I moved to the fifth chakra, the throat chakra, it was actually enlivened by the move, meaning maybe there would be more creativity there for me. And when I got to the sixth chakra, the head area, I had already moved. I knew I was moving. When I got to the seventh chakra, it was fine either way. So when I came out of the meditation, instead of taking it personally and thinking, oh no, I'm moving and I don't want to, what I understood was a whole different way of looking at it. Part of me didn't want to move, and yet the part of me that was most enlivened in the body, the root and second chakra, wanted to move. From that moment on, I had no conflict and I moved. So what I learned from this goes back to the concept of balance. When I saw that most of the states of consciousness that were housed in the body wanted to move, and that there was only one part that didn't, instead of not moving, I began to open that part of my body to the move. And in fact, it only took me about a half an hour, and then I was very excited about moving. In session 2, I'm going to give you a chance to play with the energies between the mind and the body and the heart and see actually where conflicts lie. So then you have more choice on how you deal with them. You can choose whether or not you honor the conflict that you're feeling in the body or in the mind, or whether or not you work on opening up that area. Another aspect of energy medicine that I find very interesting is that we have to clear our experiences out of the body the same way we have to clear our experiences out of the mind. I learned once that emotion should be energy in motion. And in fact, for many of us, when it's an emotion that we don't like, we tend to freeze it and lock it. And I think this actually can cause blockages in the body. We're born with blockages from congenital abnormalities like I had. We can get a blockage from a trauma or a physical insult, such as a car accident or a break in an arm, or we can have blockages from things that weren't quite brought all the way through, like an emotion. So again, somebody feels an emotion, they don't particularly like it, it's uncomfortable, and they'll either freeze it or bring it to their head and start thinking about it. When that happens, then I find that the body doesn't continue to process energy and move energy the way that it was naturally designed to. So in my practice, I clear my body of experiences every day the same way I clear my mind. We pretty much know how to do this in our culture where we do mindfulness meditation. It's come into our view in our culture to clear the mind. I think we also need to clear the body, and I have found that self-healing is stimulated a tremendous amount when people start clearing the body. A few years ago, when I got the information that my father was dying, I immediately went to my head and started thinking, as a doctor, on how I could help him. So I started thinking about which medications maybe they could prescribe and how long I could keep his life going, instead of actually feeling the daughter that's losing her father. And I knew that I was stuck and I was out of balance in that moment. So I went out to a private space. I did a clearing exercise on the body. And within about 30 minutes, I was able to clear away all of the thinking aspects of my father's death and actually drop into the full experience of what was happening. So when I went to visit him, I was available to him on an emotional and spiritual level for what he was going through. I think the question I asked myself many years ago that tumbled me into deeper developments in energy medicine was, how do I affect healing without the mind being involved? I have a clever mind, and there's a trickster in it. While it would facilitate certain aspects of my healing, it could actually stop other aspects of my healing because it would continue to replay old stories and patterns about what was going on inside my body. For me, energy medicine can work whether or not there's belief or not. I feel like it's the back door to a lot of the chronic illnesses. We can use mind-body medicine with image and word to restore the body into balance. That's quite helpful. And when that doesn't work, I love using energy medicine because it actually harvests images and answers and wisdoms from the body to help with the healing. So in any illness where the mind is suffering, this is a good way to bypass it. In any illness where someone thinks there's no possibility of getting better, or in a chronic pain syndrome, which has a really difficult thinking pattern that goes with it, energy medicine's a wonderful thing to try because it has a way of bypassing the mind. In terms of pathology in energy medicine, the imbalance happens in the energy body well before the imbalance happens in the physical body. So there's a problem in the energy body, and then the problem in the energy body affects the physical body. Then the cells may start to grow abnormally. Then one may have symptoms, and then finally there'll be a diagnosis. The thing I love about energy medicine is it goes back to before the illness and starts to affect the body before the illness occurs. When I was in medical school, I had lots of chances to play around with this, and I would scan patients before they would go into the CT scanner, and I would notice an abnormality maybe over their kidney, and then I would look at the CT afterwards, and yep, there's a kidney tumor. Now, I couldn't always do it, but I got to see the dance. So if you look at chronic illnesses especially, chronic illnesses usually have a physical component and an energy component, and often we can't find the physical component in our testing. So if we can't find the physical component in our conventional medical testing, there's really nowhere else to go besides energy medicine and mind-body medicine. So the people that I refer to energy medicine practitioners are people with pain, especially chronic pain syndromes. Anyone who's having an illness that they're struggling with, like a cancer diagnosis or anything that's causing physical and or mental suffering. And anyone with a really clever mind, because people with really clever minds can sometimes even outsmart mind-body medicine. I do think that belief is extremely important when I match a practitioner to a client. And so if someone has no belief of energy medicine, I may actually get them to start working on themselves first and see if they have an opening there. As well, when I work with clients now or patients, I ask them to work on themselves in between sessions. It's one thing if you go to the doctor and get a pill, but once you leave the doctor's office, you have to take the pill every day. And the more I work with people, I realize that I can work on them with my hands, but if they're not working on themselves in between sessions, they can unravel everything we did in one session. So I find that the more people work on themselves, the easier and faster it is for me to work on them when I'm working on them. And also, they can do without seeing a healer at all. That's the thing that's so amazing. I mean, all healing can be self-healing if we take the time and the patience. Now, the problem in our culture is that we like pills and we like things to be fixed right away. And that's a tough habit to break. I mean, that was a tough habit even for me to break when I was having my chronic illness. When I say to somebody, start doing this now, and in 9 months you'll be better, that's a difficult thing to do. And yet, that's what's required with self-healing. They're little teeny steps. I mean, every once in a while somebody will have a miraculous, spontaneous healing, but usually they're little teeny steps. So when I work with people with energy medicine and self-healing, I ask them to look back at 9 months ago, not at yesterday. And that if they look back from 9 months once they started working on themselves, they'll notice an extraordinary difference in their life. I want to talk a little bit about touch, because I think touch is primary, and I think it's a potent healer. And we know from data that touch can decrease heart rate. It can lower blood pressure. We know even just from touching animals and having animals around that it can really help the body's stress level and decreasing the amount of stress that the body has. We know that children need touch, and if young babies don't get touch, they don't actually develop properly. So we know that touch is extraordinarily important in our society, and yet we don't really make use of that. And that's the other thing I find so profound about energy medicine, is that while you can change energy in a body using music or sound or vibration or light, most of us do it through touch. And just being touched by another human being to the body is a healing experience. One thing I notice in my hospice practice is that with my patients who have dementia, even if they're completely gone, if I touch them, they come back. They come back through two things. They come back through touch, and they come back through laughter. It may just be for a brief moment, but they come back and they connect. And both of those are profound healing practices, both touch and laughter. Laughter can move as much energy as crying or as a good healing session. So I often will suggest to my patients that they go see a funny movie, and that'll start to open up their chest and make them feel better if they have a cold, or depending on what their illness is. In session 2 of this program, we will have an experience with sacred touch. I wanted to share Sacred Touch with you because I think it's extraordinary. And we can practice Sacred Touch as we go through our day. I mean, it would be very interesting to take one day where everything that you touch in a sacred way, and just watch the response of the people, even the person at the checkout counter. When they hand you your change, watch the effect it has on them. It's really wonderful. In my own healing, one of the things I found most important was that the perception of what was going on was only a small fraction of actually what was going on. So the perception of the illness and the events that had happened to me up till that certain point had molded the way that I was seeing it. The perception was the filter that I was seeing it with. And when I began to shift my perceptions, the illness that I had began to look very differently. One thing that I find is so important in energy healing is it allows people sometimes to shift the way they view what's happening to them. And that alone is a healing. We see this a lot with oncology patients. Oh my goodness, the first thing they find out they have cancer, and it's devastating. But if you stay with them and watch them through the process, they start to understand the deeper mystery of having the cancer, and the cancer starts to become a transformative experience. I find the same thing true when I work on myself with energy medicine. If I can stay with the experience without judging it, allow the filter to shift, then I have a very different experience of what's happening. In session 2, I'm going to share the Heart Center with you. I find that if I can shift and look at something, an illness or a problem or a form of suffering from the Heart Center, I have a radically different experience than if I just look at it with my normal, ordinary awareness. And I find that if I look at it through the Heart Center, more resources actually available to me. Let me give you an example in my own chronic illness. I had pelvic pain for many years and I was upset by it. But when I learned how to Heart Center, instead of being upset by it, I was able to explore it. And through exploring it, I tumbled into all these ways of healing it, and now I'm pain-free. It was changing the filter to open to what the body and the energy in the body had to tell me, instead of saying, no, I shouldn't be having pain and this is the way it should be, which is what many of us get locked into when we become ill. Now I want to spend a little time talking about chronic illnesses that I see frequently in my practice and how to work with those. I see a lot of anxiety in my work. And in session 2, the first exercise I present, toe tapping, is extraordinarily helpful for anxiety. Now, the thing about anxiety is that the autonomic nervous system is in charge of what's going on with the body at that point. And so once somebody's having an anxiety attack, sometimes it's too late to start doing the practice and slow it down. Sometimes it's not. So the thing with anxiety is that you have to do exercise 1 and exercise 2 when you're not anxious. Train the body when it's not anxious, so that when the anxiety comes, the body will actually start doing the movements in the practice for you. It usually takes a couple of weeks, but after a couple of weeks, the anxiety will decrease remarkably. Or when you start to have an anxiety attack, you can lay down on the floor and tap your toes. It'll go away, usually within a few minutes. Depression is another thing that I see often. I have great reverence for depression because I think that it has quite a bit of meaning. I think in depression that part of the person has gone down into another place, almost like to retrieve something that they've lost. They've gone into a place that's more in the unconscious than the conscious part of themselves. It's very difficult, and of course there's always a fear that we won't make it through. I find that using the Heart Center and also the full body connection is very helpful in depression because the body and the mind will still respond to the touch even though the person's depressed. It's one of the few ways to connect with somebody in a deep depression. It has great meaning to still be touched. So if you're working with depression, I would do the movement exercises, and I would also spend some time with the Heart Center and the body connection. With chronic pain, like I've already said, I would go very slowly and I would do all the exercises. But I would start off with each one only 2 minutes a day. And I would really try very hard to do it every day. One thing I've noticed with chronic pain is that it's very hard to keep a routine because the pain is actually in charge of the well-being. It's almost as if the pain is the filter that the world is seen through. And so you have to sometimes strike a bargain with yourself to get yourself to do it every day if you're experiencing chronic pain. Just these 10 minutes a day. Now, neuropathy is something I see quite a bit in my practice, and the toe tapping works for both neuropathy and restless leg syndrome extraordinarily well. I often think about neuropathy as there's a block in the hips and there's not quite enough energy flow in the toes. So the toe tapping will stimulate all of the energy centers and meridians in the legs. Again, go slow. And for neuropathy, if the toe tapping is painful, I suggest people get a handheld massager and keep it by the bed. And they can just run the massager on the neuropathy, and it usually will subside for about 15 minutes, sometimes longer. Sometimes they have to do it every single day to make the pain subside, but it'll often give them enough time to fall asleep. Same thing with restless leg syndrome. The restless leg syndrome is often too intense for patients to sleep. Then they end up sleep deprived, which makes their pain worse. And if they can use a handheld massager on their legs at night or do the toe tapping, often it'll get the flow going enough that they can settle down and get to sleep. Now, chronic fatigue is something that we have to be careful with energy medicine, because anytime you add more energy into a body that has chronic fatigue, sometimes it can give them a little flare. Not a large flare, but a small flare. So with chronic fatigue, my experience is that patients need to go slow. I would do exercises in the second session, try them all, and see which ones help the pain subside. Chronic fatigue and fibromyalgia have similarities in this. And one thing I find with my chronic fatigue and fibromyalgia patients is that they're so anxious to get better that when I give them an exercise, sometimes they overdo it immediately. Then they get a flare of their symptoms, and then they won't do the exercise again, understandably so. So one of the things that you want to do is be very regimented, like I talked about with chronic pain, and make sure that you do at least 2 minutes a day. Cancer. The one thing I've noticed with cancer patients is that they have great fear and often great ambivalence about going for chemo and radiation. And I think that's really coming from the mind. When I work with cancer patients, one thing I try to get them to do is really open up to the energy of the medicine that's coming in. So I have them open up to the sacred aspect of the chemotherapy, and I try to help them approach the chemotherapy the same way they would approach a sacred herb or a sacred ceremony that was being presented to them. And my experience is if I can help them open to the chemo so the body can receive it more fully, then they have fewer side effects. So if you're experiencing cancer right now, I would suggest you practice the heart center meditation and some of the movement that is presented in the second session. When I work on patients after they've had chemotherapy, their body is actually enlivened by the chemotherapy. Now, obviously, that's because the chemotherapy is going in and doing its job, which is to kill the cells that are reproducing. But at the same time, the body usually gets activated by the chemotherapy, which I found so surprising the first time I worked on somebody getting chemo. We think it's this horrible thing we're putting our bodies through. And so with cancer patients, the one thing I would encourage you to do is to really embrace the chemo or the radiation as healing and thank it as it's on its way in, and you might have a very different experience. I met a woman a few years back who had been through breast cancer twice, and she shared a story with me. The first time she had gone through the breast cancer, she had turned down the chemotherapy. But when the breast cancer returned, she accepted the chemotherapy. In part, she said she accepted the chemotherapy because her family wanted her to have it, and she knew it was important to her that her family agree with her treatment on this recurrence of the cancer. That alone was a pretty profound teaching for me. But then she continued in her story. And she told me that the first chemo she got, she had lots of side effects, and it was really difficult for her. And the second session of chemo, the same. But by the third session of chemo, she decided to ask the chemo, "What are you?" And she began to have incredible experiences during her chemotherapy where she opened and started to have visions and journeys all throughout the chemotherapy experience. She was able to shift from, ugh, to, oh my goodness, what is this? And it was really that she changed her filter. And she opened to the experience as fully as possible because, of course, I think medications are bringing energy into the body as well. So for me, she was a profound teacher on how opening to a substance or an energy or to an experience that we find difficult in our culture actually can lead us down a profound path. The last thing she said to me was, of course, when I finished with all these chemotherapy treatments, I knew the cancer was gone. And I intuitively knew what she meant. I mean, she had opened so fully to the chemo and to the experience that was being presented to her, there was really almost no chance of it coming back. Now, of course, healing is always grace, too. So I don't want to give the idea that if you open up, you heal, and if you don't open up, you don't heal. I think that the opening up is the healing, and then whether or not the illness continues, well, some of that's grace as well. In the paradigm of energy medicine, energy can be moved multiple ways. It can be moved through the hands, which is a little bit of current or electricity that goes into the body. It can be moved through voice or sound. It can be moved through vibration, which can be sound or the voice, but it can also be drumming or rattling. It can be moved through light. Anything that has energy can move energy. And when I started understanding all the different ways of moving energy, I started understanding all the different energy practices out there. Shamans are moving energy in ceremony all the time by using sound and rattling and even sometimes smells. Healers are using their hands or their voices. Musicians are moving energy in our hearts usually through their music and their playing. So once I started seeing that it's all energy and how energy is moving, I was able to catch a glimpse of how all these different modalities work. So as you start working with healing your own body and maybe even trying on other people that you know, I want to encourage you to use your own techniques. Some of the techniques that I have found most profound were just ideas I had during a healing session. Oh, try your voice on this part of the body. Or, oh, try using this toning bowl all around the head and see what happens. So I want to encourage you to start learning about it and also start listening to your own body, listening to what it likes, not what it thinks, because that's coming from the head, but how is it feeling? Is it feeling enlivened by this experience? Does it enjoy what's happening at this moment? And you will find your own way into self-healing quite easily. So one thing I've noticed in teaching energy medicine is that everybody perceives energy differently. What I've noticed is that you have to find your own way of perceiving. So for me, I perceive through touch. Many of my students don't. I had a student once who could perceive the energy field through his hearing. His ears had been trained in one of the wars for listening to espionage channels for messages. So his ears were extremely trained. And when I began to work with him, it was his hearing that was how he heard the energy field. He could hear the chakras. He could hear the energy fields on the body. Some people can see them. I have friends and colleagues who can see colors and perceive colors as they're looking at people. Some people use feeling, which is another way that I do it. You can kind of feel what's going on. You just get that sense of what's happening. So whatever happens for you is the way that you need to explore it. Most people have this idea that they're going to see the energy field and they're going to see a burst of rainbow and colors around the person's head the moment that they open up. But that's not usually what happens, although it did happen once to a medical student who was visiting in Tucson. But it doesn't usually happen like that. You have to find your way into it. And in my experience, the changes happen very slowly. Usually, almost imperceptibly, the opening and the sensing of the energy gets better and better. So again, I want to ask you to look back at 9 months ago instead of looking at yesterday. There's not enough contrast in the difference of your perception of energy from yesterday to today to be noticeable. But if you look back 9 months before, it'll be easy for you to see how your sensitivity has shifted. I also would encourage you to begin to explore intuition, because as you work with energy medicine, your intuition may open up. Now, my intuition actually comes through the body. I don't get flash insights usually. Usually my intuition comes through the body, and you may be the same. And if that's true, the more you practice the art of touch, the more your intuition will open up. So we've talked a lot about energy medicine and energy healing. Now it's time for us to get to it. So in the next session, I'll give you exercises to help with clearing your body, heart centering, and then using your hands to transfer energy. And while you do this, I want you to keep in your mind, what is your medicine? how is the way you do this? So you can learn from me and you can learn from other healers in your community. But I also want you to find out, what's your knowledge on this? What is your medicine to practice and teach?
Sounds True presents Self-Healing with Energy Medicine, Session 2, Guided Exercises for Self-Healing with Dr. Anne-Marie Chiasson.
In this session, I will guide you through a series of exercises that will help clear and restore your energy body and your physical body. We will start with 2 exercises that will help ground you and drop your energy body into the lower portion of your body to prepare for deeper work. Next, we will practice the art of sacred touch. We will awaken our hands to go more deeply into energy work. From there, we will move into the heart center, a transpersonal state of consciousness that will allow access to healing states of consciousness that are not in our normal states of awareness. Then we will move into a full body energy healing. The last 2 exercises on this session are designed so you may work with the energy of the earth, as well as begin to learn how to explore body states of awareness in your own body while you're walking through your daily life. Pregnant women should skip the first 2 exercises on this session. Additionally, if you find you experience any very uncomfortable symptoms or sensations during these exercises that are difficult to move through, please discontinue. I hope you enjoy. Toe tapping. Lay down on the floor in a comfortable location. If you have any problems with your back, lay down on a bed. Allow your legs and your hips to be very relaxed. Close your eyes and take a long, deep breath. Rotate your feet in so your large toes touch, and then rotate your feet out so the edges of your feet begin to touch the floor. Do this again. Notice that the movement is actually coming from your hips, not from your knees or your legs, and that your thighs are actually rotating in and out as well. This is the movement of toe tapping. Begin to rotate your feet more quickly and allow the tapping to be quite forceful. You will notice 2 things at the beginning of this exercise. Your big toe might feel some discomfort. That's okay. Just work right through it. It'll go away in about a minute. Second, you may notice that you have a little bit of burning in your inner thighs. That too will pass, probably within a minute or 2. Just relax and continue to tap your toes together. The faster you tap your toes, the easier the exercise is because you use less muscle while you're doing the rotation. This exercise is great for anxiety, restless leg syndrome, and many disorders that involve the uterus, bladder, and lower aspects of the body. I will play some music here to help guide you through the meditation, although music is not necessary. I find music easier because it allows the body to move along with the beat. Relax. Tap, 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 tap. Relax and allow yourself to get lost in the music. Take long, deep breaths. If you notice discomfort in your toes or in your legs, just keep tapping. Tap, 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 tap. The discomfort will go away within a minute or two. Notice how difficult it is to think while we do this exercise. If you're able, focus on your breathing now as well. Long, deep abdominal breaths. Relax the muscles in your legs more now while you tap. This exercise is opening liver, stomach, and spleen channels in your body. Stay with it. Tap, 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 tap. Long, slow breaths, and increase the intensity of tapping just a little bit more. See if you can find the trance state in this exercise. Slow, deep breaths. Keep tapping as you notice other sensations in your body. How do your hands feel? How does your belly feel? How does your heart feel? Slow your breathing down. Tap, 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 tap. Keep tapping. Keep tapping. You can stop. Stay where you are and feel your body. Where's your primary awareness? Is it behind your eyes, in your chest, in your belly, or in your feet? Notice the difference now about where your primary awareness is versus when you're walking through the world. Stay here for as long as you'd like, relaxed, enjoying this feeling. Shaking the bones. Stand comfortably with your legs apart at a comfortable distance. Imagine a cord from the top of your head going up to the sky, your feet rooted in the earth. Imagine something shaking that cord up and down. Bounce from your knees up and down like a rag doll, allowing your entire body to go relaxed, feet rooted firmly in the earth. Allow your neck to go limp and roll around from side to side. If you have knee problems, just gently sway back and forth and allow the rest of your body to do the movements. You will notice where you carry your attention. It may be in your neck, your shoulders, your hips, your legs, your arms. Whatever you notice, just try to shake that area out a little bit more. I will play some music to help guide you through this exercise. Let's begin. Close your eyes and begin to shake. Use the beat as your guide.
Mother is rhythm.
Let your neck go. Let your arms move. Shake. Gently move up and down and allow everything to move out. Take all the experiences from earlier today and yesterday and shake them out. Move them out until you're clear. Use your breath. Take deep breaths. Use your voice if you're called. Keep your neck soft, your shoulders soft, your arms and hips and legs soft. Whatever's shaking that rope is now shaking harder. Move more fully into the exercise. If you notice a wave of emotion, shake it through. Joy, grief, move it through. Notice what you're feeling now. Shake that out too. Keep shaking. Let your breath follow the movements. Good. Take a couple of deep breaths, and we will re-enter, shaking the bones again. Find your place and begin to shake. Bring up an experience of something that you found very uncomfortable or a memory that's painful. Don't think about it, feel it, and shake it into the earth. Move until the experience moves in your awareness, until you have a different experience of it. Move the energy through your body. If the experience is in your head, move it low into your hips. If it's in your hips, shake it until it moves to your heart. If you get tired, you can do this with small movements. They don't have to be large. Keep your breath engaged. Notice your feet and your knees and your hips. Keep moving. Notice your belly, your heart, and your chest. Keep moving. Notice your hands, your shoulders, your upper arms. Keep moving. Notice your neck. Keep moving. Notice your head. Keep moving. Use this time now to clear old experiences and old feelings. Keep using your breath. Keep moving. As you shake, allow yourself to relax more. Connect now to what's coming ahead of you. The end of this day, tomorrow. Quiet yourself, close your eyes, and see how your body feels. Slow your movements and begin to come back to the present. Stop and open your eyes. We'll move on to the next exercise. Now we're going to move into sacred touch. I will lead you into an exercise that will allow you to experience the difference between touch in an ordinary state of awareness, touch with fear, and touch with sacred intention or compassion. I think the quality of touch at the level of the body is as important as who's touching the body. With self-healing, the quality of your own touch is as important as the intention you have toward healing. Sit comfortably in a chair or on the floor. Gently place your hands somewhere on your body that is comfortable, perhaps on your legs. Pitch your awareness to the quality of that touch. How does that touch feel on your body? Now, close your eyes and send compassion and reverence to your body. Imagine you're touching the most sacred object you've ever had the opportunity to touch. It could be a newborn baby. It could be an ancient relic. It could be your beloved. Through your hands, sending compassion and reverence to your own body. Now, pitch your awareness to your body. How does this touch feel? Shifting now, touching your body as if you were afraid. Placing fear in your hands as if you were afraid to touch your own body. How does this touch feel? Move back again to placing compassion and reverence in your hands for your body. Pitching your awareness one last time into your body to noticing the quality of that touch. Each time we touch our own body or another, we have a choice of the quality of touch. This is the art of sacred touch. Now we'll move into the heart center. Many people think that the heart center is a personal love and a place of compassion, yet I find it's much more. The heart center, for me, is a transpersonal state of consciousness. It's not in our ordinary everyday awareness. For me, this is the wellspring of healing. It's actually the source of divine healing located within the body. So when I do healing work, I always start with the heart center. We'll begin now by an exploration of the heart center. Before we begin, I'd like to show you the mudra that I use during the heart-centered meditation. Start with your right hand placed mid-chest. Place your left hand over the right hand and let your thumbs touch. Gently rest your hands on your chest. If it requires any effort, then push a little more deeply into your chest and relax. The heart center has 4 aspects. The first is compassion. The second, innate harmony. The third, healing presence. And the fourth, unconditional love. Close your eyes and take a few deep breaths while I bring you into this center. With your eyes closed, slow your breath. The first aspect of the heart center, compassion, oceanic compassion. Bring up an image of something that makes you feel compassionate. Breathe compassion. Be compassion. With each breath, deepen into oceanic compassion. Allow it to flow through your entire body. Compassion. Now, gently shift your awareness to the second aspect of the heart center, innate harmony. It's the calm in the midst of chaos. It's the eye in the center of the hurricane. It's the still point. Finding the place inside that knows innate harmony. No matter what's happening around you, that still place. Innate harmony. Breathe it in and breathe it out. Become innate harmony. Calm in the midst of chaos. Let it perfuse your whole body. Innate harmony. Now, shift your focus to the third aspect of the heart center, healing presence. The longing and desire to move toward healing. Healing presence. With each breath, allow yourself to feel the longing for healing. Desire turned into service. Healing presence. Allow it to radiate through your whole body, into your hands, and back into your own heart. Healing presence. Take a deep breath in and allow your focus to shift again to the fourth aspect of the heart center, unconditioned, unconditional love. Allowing each thing to be exactly as it is. Take a few deep breaths in the quietness of unconditioned, unconditional love. Unconditioned, unconditional love. It's not personal love, it's divine love, with the ability to love everything and anything that comes into its focus. No judgment. Unconditioned, unconditional love. Breathe it in and breathe it out. Allow yourself to be unconditional love. Now we'll prepare for heart centering before healing. With your hands on your chest again, right hand over your mid-chest, left hand over that, thumbs touching. Take a deep breath and let's begin. Use the aspects of the heart center as an internal mantra as we moved into the heart center space. Compassion, innate harmony, healing presence, unconditioned, unconditional love. As you internally repeat these, allow yourself to activate so your whole body becomes the heart center before you move into healing. Compassion, innate harmony, healing presence, unconditioned, unconditional love. With each breath, repeating the mantra that calls you. Allowing your whole body to experience the heart center. Now asking to go one level deeper. Compassion, innate harmony, healing presence, unconditional love. With each breath, dropping in deeper. Compassion, innate harmony, healing presence, unconditional love. allowing the healing work inside your own body to start with this simple meditation. Asking for any healing that you're seeking from the source. Compassion, innate harmony, healing presence, unconditional love. Breathing deeply, feeling it throughout your whole body. Noticing how you feel and opening your eyes. Now we're going to do full body energy connection. Find a comfortable place to sit on a bed, on the floor, or in a chair. Take a couple of deep breaths and send some compassion into your hands. We'll start with the left leg. Place your right hand on your left foot and your left hand on your left knee. Close your eyes and envision flooding your lower leg with white light. See if you can feel a connection between the two hands and send this light or energy back and forth. Once the hands feel connected, send more energy in, flooding your lower leg with healing energy. Now we'll move our right hand to the left knee and our left hand to the left hip area. Feel your hands connect and flood the left thigh with healing energy. See if you can feel the energy going back and forth between the palms. continue to flood the leg. From here, we'll move to the right leg. Place your left hand on your right foot and your right hand on your right knee. Feel the connection between the hands. Allow the connection to deepen, and then flood the lower limb with healing energy. With each breath, see if you can send more energy into the leg. Allow your hands to appear like white balls of light. Now move your right hand to your right hip and take your left hand and place it on your right knee. Feel the connection between the two hands. And begin to flood the upper leg with white light or healing energy. Flood it with warmth. Keeping the right hand on the right hip, now place your left hand on your left hip. You may stay seated here, or you may lay down on the floor. Feel the two hands connect, flooding your hips and pelvis with healing energy and heat or warmth. Now, moving your hands from your hips, place your right hand between your legs and your left hand above your pubic bone and below your belly button. Breathe into these two hands and feel them connect. Now, flood the area with healing energy. See your body begin to fill with white light. Notice any images you stumble upon while you do this work on yourself. With each breath, send more energy into this area. Now, move your right hand to your solar plexus. It's located right at the top of your abdomen, below your rib cage. Leave your left hand on your lower abdomen. Feel these two hands connect and flood your abdomen with healing energy. With each breath, send in more energy and see your abdomen alight with healing energy. take your left hand and place it mid-chest over your heart center. Leave your right hand over your solar plexus. Feel these two hands connect. Once connected, begin to flood these areas with healing energy. With each breath, send in more energy so you start to see your chest lighting up with healing energy. Now, take your right hand off your solar plexus and slip it underneath your left hand back to the heart-centered mudra. Right hand on the mid-chest, left hand over the right hand, thumbs touching. Feel the hands connect and allow the energy to flow from your heart, out your arms, and back to your heart. Fill your arms with healing energy. With each breath, filling them more. Leaving your left hand on your mid-chest, place your right hand over your throat. Feel the hands connect. See if you can feel a connection or a vibration going back and forth between the two. Now, flood your chest and throat with healing energy. Envisioning light coming out of both your hands and into your body. See if you can see your hands dropping into your body, spreading the light. Once this area is done, take your left hand and put it on your forehead, leaving your right hand over your throat. Feel these two hands connect. Once you feel them connect, begin to send healing energy into your head and throat. With each breath, send more healing energy until you see your whole head and throat alight with this healing energy. Now take your right hand and place it on top of your head. Leave your left hand on your forehead. Feel these two hands connect and begin to flood the upper forehead and top of the head area with healing energy. With each breath, send in more energy. Drop your hands down to your side and feel your body. What area needs more work? Do a quick scan to see how everything's feeling. We'll take some time now to send a little more energy into areas that may seem to need it. Isolate an area of your body that feels like it needs attention and place your hands over it. Send in the healing energy now. With each breath, send in more energy until you feel like you've filled the area completely. With each breath, increase the amount of energy coming out of your hands into the body. Envision your hands almost dropping into your body to send the energy. Okay. Coming back to the here and now, coming back to the room. Now, bring your hands back and rest them on your legs and take a few deep breaths. That state of healing we just visited is always available to you, and you may do this exercise each day if you'd like. Hands may be placed anywhere on the body that you feel needs attention. So use your own guidance as well as my meditative suggestions here today. For this next connection to the earth exercise, you need to find a comfortable location on the floor of your house. This exercise is done best with speakers, not with headphones. Once you get the hang of this exercise, I suggest that you do it outside, as it is more profound the closer to nature you get. Lay down with your belly to the floor and put your hands to your side on the floor. Close your eyes and take a few deep breaths. Begin to see if you can open your energy field. See if you can soften and open that layer of protection that we all wear around us in our day-to-day life. Envision yourself taking off one layer of skin for this exercise. Feel yourself open and connect to the earth. With your first breath, see if you can go in a few inches. And with each breath that you take subsequently, see if you can expand your energy field out, down into the earth. Notice any sensation in your body as you do this. See if you can soften the interface between yourself and the surface of the earth. So you and the earth start to become one. So where your skin ends and where the earth's surface starts is a softer, hazy area, almost as if they're dancing together. You may want to put your arms out and embrace the earth. See how that feels. And quietly rest one of your ears on the earth's surface and listen. What do you hear? With each breath, connect deeper. Envision yourself connecting all the way to the core. Now, pick up your head and turn it the other direction. Rest your other ear on the earth. What do you hear now? Keep your breath deep and rhythmic. Continue to feel yourself softly resting into the earth's surface. It's holding you. Scan your body for anything that you no longer want to carry, and see if you can actually offer it to the earth. See if it will take it, transform it. Now, roll over and lay on the earth's surface with your back. Keep your eyes closed. Open your back the same way we opened our belly to the earth. Feel the softening between your skin and the earth's surface. Feel the two edges merging. Let go and let the earth hold you. Allow it to take anything that you no longer need. Ask for its assistance with healing. Listen to any gifts that it has to bring to you. As this meditation comes to a close, thank the earth. Use your hands to feel it. Send some gratitude down for that which we're walking on all day long. And bring yourself to a seated pose. And allow yourself to complete this meditation. Now I'd like to guide you through the last practice in this session. This practice is an exercise to awaken awareness of your body response. We will use the Taoist model of the dantians. The lower dantian is in the lower portion of your belly. The mid dantian is in your chest area, and the upper dantian is in your head and throat area. Find a comfortable place to sit, close your eyes, and take a few deep breaths. I'd like you to bring up the image of an activity in your life that you enjoy doing. Placing your hands on your lower abdomen, what is your body's response to that activity? Is it enlivened? Is it calmed? Is it softened? Or does the energy decrease in your body from this activity? Now move your hands to your mid-chest. How does your mid-chest feel about that activity? Is there a quickening? Is there a softening? How does it feel? And finally, place your hands on your head or over your eyes or over your forehead. What does your head think of this activity? Does it like it? Dislike it? Think it's worthwhile? A waste of time? How does your head feel? Now, drop your hands to the side and bring up an image of someone you love. We're going to do the same series of exercises again. Place your hands on your lower abdomen and take a few deep breaths. How does your body feel about this person? Is it connected to them? Enlivened? Softened? Quieter? Moving your hands to the mid-chest. How do you feel about this person? Compassion? Love? Joy? Sadness? Placing your hands now on your forehead. What does your head think about this person? Again, dropping the hands to the side, taking a couple deep breaths. And now I want you to bring up someone that you feel conflict with. Take a couple of deep breaths and bring them up into your awareness, feeling all about them. Placing your hands on your lower abdomen. How does your body feel around this person? Make no judgments, because the body might feel differently than the head. Is the body quickened, enlivened, softened, or quieted by this person? Is there a relationship between the two bodies? If you find yourself saying, "I think," drop in deeper, because the body doesn't use words like think. Look for a sensation. Now, move to your chest area. What does this part of your body feel for the person? Love? Tightness? What is the feeling level there? Finally, place your hands on your forehead. What do you think about this person? Do you like them? Dislike them? Is there conflict? Don't be surprised if you find that not all three centers have conflict with this person. And I would suggest to you the next time you see them, see if you can focus on the part that does not have conflict with them. You may have a different experience of them. Taking a few deep breaths with your hands down to your side. When you're ready, open your eyes. I hope these practices that I've presented are helpful in your exploration into energy medicine and self-healing. You can use these practices at any time and for as long as you like. In fact, my wish for you is that you take them and use them and make them your own.